Hello viewers, welcome to Biology in a Nutshell, and today we are with another topic called an infarction. So what is an infarction? Infarction is nothing but a tissue necrosis. A tissue necrosis, to be more specifically, coagulative type of tissue necrosis resulting from ischemia. What do you understand by ischemia? Ischemia is nothing but reduced blood flow. So an infarction can be defined as a tissue necrosis, especially a coagulative type of tissue necrosis resulting from ischemia. And the localized area where such a necrosis takes place is called an infarct. So now let's talk about the etiology of an infarction. Etiology, in order to understand the etiology of an infarction, we need to know what exactly does this term mean. See, etiology and pathogenesis are almost similar because both of them deals with the causes of disease, but what differs them is etiology initiates the cause, whereas pathogenesis continues. That means the set of things or set of events that is happening in the cause of a disease is called as pathogenesis. So now let's understand what is the etiology of an infarction. All causes of ischemia can result in an infarction. However, some points we need to remember when it comes to infarction, etiology of an infarction is mostly an infarction is caused by ischemic necrosis. What is ischemic necrosis? What causes ischemic necrosis? An arterial interruption. An interruption in the arterial blood flow can result in ischemic necrosis. So most commonly infarction is caused by ischemic necrosis. Now the next one, less commonly it is caused by stagnant hypoxia. What causes stagnant hypoxia? A venous obstruction causes stagnant hypoxia. Don't confuse the both. Ischemic necrosis is caused by arterial interruption, whereas stagnant hypoxia is caused by a venous obstruction. And the third most common reason is a sudden, complete and continuous occlusion. When you read this sudden, complete and continuous occlusion, think about this. There's a sudden blockage in the blood flow. What can cause a sudden blockage? Think for a while. What can cause a sudden blockage? When you think, you will always come and conclude at thrombus or an embolus. A thrombus or embolus can only be a sudden cause of occlusion of an artery or a vein. Okay, so that is what they mentioned here. Generally, a sudden, complete and continuous occlusion is caused by thrombosis or embolism, can produce an infarct. And another, the most fourth common cause of an infarction is a non-occlusive circulatory insufficiency. In order to understand this, let's think about an example. Okay, let's talk about myocardial infarction. Myocardial infarction is nothing but heart attack. Okay, myocardial infarction is also a kind of infarction, that is a non-occlusive circulatory insufficiency infarction. This is a complicated sentence that I'm saying, so in order to explain you, I'm going to draw it. Let's think this is the coronary artery. Okay, let's say this is the coronary artery, and now there is fat deposition. Okay, incomplete fat deposition. This incomplete fat deposition has happened now, and now the blood has to flow, right? When the blood flows, it cannot flow like before. Now the path where the blood flow has narrowed, isn't it? Before, the blood can flow easily. Now since there is fat deposition, the path has narrowed, and this can also result in an infarct, and such an infarct is called as myocardial infarct. And when we say a person has undergone myocardial infarction, in medical term it means the person has undergone a heart attack. And now you can relate. Okay, so heart attack is also a non-occlusive circulatory insufficiency infarction. Okay, these are the common sites where an infarction can happen. Infarction can happen in brain, infarction can happen in the retina, infarction can happen in lungs, or it can even happen in heart or spleen. Infarction can happen in liver, infarction can happen in small bowel, kidney, or in our lower extremities. Lower extremities means our legs. So coming to the types of infarcts, according to their appearance, according to certain features, infarcts are classified into three types. Okay, and those features are their color, age, and absence or presence of infection. So we will see one by one, so you'll understand. I'll explain one by one. According to color, they are divided into two. Okay, they are classified into two. First one, pale or anemic infarct, or second one, red or hemorrhagic infarct. Okay, a pale or anemic infarct is caused due to arterial occlusion, and this kind of an infarct can be seen in compact organs, for example in kidneys, heart, and spleen, whereas a red or hemorrhagic kind of infarction is seen in soft and loose tissues. And a red or hemorrhagic infarction can happen due to a pulmonary arterial obstruction, example in lungs, or it can also happen due to arterial or venous occlusion, like the previous one I said here, it is due to an arterial occlusion. So a red or hemorrhagic infarction can also happen due to an arterial or venous occlusion, example in our intestine. So this is a very small one. According to their age, it is classified as recent or fresh infarct, or old or healed infarct. And according to the presence or absence of an infection, they are classified as bland and septic. What do you mean by bland? So most of you will be confused what is bland. Bland is nothing but the absence of microorganism in an infarct. When there is an absence of microorganism, it is called as a bland infarct. Whereas a septic infarct, we all know septic means there is infection by a microorganism. So that's it for today. I hope I covered what is an infarction, and we also spoke about the etiology of infarction, and we saw what are the three types of infarction, according to what the three types of infarction are classified. Our next class will be based on the pathogenesis. So if you want to see the pathogenesis of an infarction, make sure you subscribe, like, and stay tuned until I upload the next video, and mostly the next video will be out by Tuesday. So that's it. Thank you.